Welcome back to the MRMC Doctor's Office program. And this morning we're pleased to have Dr. Sindhu Singh with us. She is an oncologist with MU Health. And Doctor, thanks so much for being with us today.
Thank you so much for inviting me. It's really great to be here. Thank you.
Tell us a little bit about yourself. How did you get interested in the medical profession to start with?
Well, I was born in India, and since I was little, I couldn't think of anything else but becoming a physician. And my grandfather died of lung cancer, so cancer was something that I was always passionate about. I did my med school in New Delhi and then moved here to U.S. I did 2 years of breast cancer research at Harvard and then finished my residency in Omaha, Nebraska. Then I went on to do my fellowship in West Virginia, and I was at faculty at Oklahoma University for 3 years where I specialized in breast cancers and genitourinary cancers. So genitourinary cancers include prostate cancer, bladder cancer, testicular cancer, adrenal cancer, and breast, breast cancers are of various kinds. And then I moved here, and I've been focusing mainly on genitourinary cancers, but I see a little bit of breast, little bit of stomach, lung, colon, pretty much everything. So that's my journey, kind of short and sweet.
Do you miss India at all? I know I'm a big fan of Indian food, by the way.
Yes, I do miss, and I just have to plan a vacation sometimes to go back and visit my family. But this is pretty much U.S. is my home now, so I do miss India, though.
All right. Tell us about your family, too. I imagine they're a real important part of what you do.
Yes, so my parents live in northern part in a small town known as Varanasi, and I have one younger brother who is Indian Railways, who works for Indian Railways, and he has two small children. I live here with my husband and two children, and we have some family here, mostly on my husband's side. I do have a cousin who lives in California side, so not many relatives, but we do have a few here.
All right, and for you to do what you do, your family has to be committed because I'm guessing there's an awful lot of hours you're putting in, aren't you?
Yes, and I'm lucky to have that kind of support. Everyone is very understanding. My daughters know that I work long hours, and they have learned patience. I do work a lot of weekends, so they're all very supportive. I do have friends who help out with the kids. So the community here in Colombia is pretty helpful. I've made a bunch of new friends who help out whenever I am on call or busy or I have to go attend a lecture or something. So, I'm happy to be in Colombia and a part of the community.
And Doctor, the reason I ask you so much about family support, you deal with obviously a lot of patients with cancer. How important is it to involve the entire family when you're talking about cancer treatment?
It's extremely important because cancer is a life-changing diagnosis, and it's not a diagnosis like blood pressure or diabetes. So cancer comes in 4 stages, stage 1, 2, 3, and 4. And most cancers, when they are stage 1 to 3, we can cure them. But stage 4 means most of the times that we may not be able to cure, although things are changing now. So a whole family, your spouse, your brothers and sisters, the kids have to be involved because not only the patient's health is affected and there is a prognosis in question, but also people who are going to be taking care of the patient, it can be pretty heavy on them. They have to bring the person for hospital visits, make sure that they understand everything, when they're going to get the blood draws, when is the scans are going to be done, when they have to follow up with some other specialists, because cancer treatment now, many doctors treat cancer, like surgeons, radiation oncologists, so a whole team is involved. And so the appointments can take pretty much the whole day. And one patient who has cancer, they cannot deal with all this by themselves. So they need to have good support, like either in the form of friends, spouse, parents, or children who will help them out.
Doctor, how many people does cancer really impact, or would it be easier to say how many people does it not impact?
Well, I think 1 in 4 or 5 really the incidence is pretty high. Now, lung cancer is the rule of the thumb is like women get more breast cancers than lung cancers, than colon cancers, and the men get the number one disease in men as far as cancer is concerned is prostate cancer, followed by lung and colon, but mortality is highest for lung cancer. And again, I cannot give you a general number because the incidence is much higher in smokers. So if the person smokes, then their chances of getting a lung cancer and also dying from it are probably higher than somebody who doesn't. We can, lung cancer maybe 1 in 3 or 4, kidney cancers maybe 1 in 8. So cancers vary.
All right.
Some cancers will have less incidence compared to some other ones.
Well, you brought up a very good point indirectly there. Is there any way to prevent someone from contracting some particular form of cancer? Is there anything we can do to prevent this?
Yes. I mean, I think the majority of the cancers that I see in clinic, if people were to stop smoking, our burden of cancer care would be much less. The cost of cancer care would be way, way, way less. So smoking is the number one killer, and not only cancer, it will cause other diseases too, like heart disease, and heart disease is a silent killer too. Plus, smoking will harden your arteries, so it can cause things like strokes. So smoking is number one, I can say, and some other things like if you can have a much active lifestyle and prevent heavy body weight. Studies have shown that the women who are overweight, they have higher incidence of breast cancers. So although breast cancer, not so much. I mean, if you exercise, keep your bones healthy, then you have much less chance of getting pretty much any cancer. Bladder cancer, smoking literally is responsible for majority of bladder cancers. So, and we see a lot of morbidity secondary to smoking. Plus, if person is not active, they eat unhealthy food, they're overweight, that's another big one there.
Doctor, someone wanted me to ask you too, how about secondhand smoke? How does that potentially affect someone?
So that's, although they're not inhaling it directly from the cigarette, but living with someone or being in vicinity of someone who smokes definitely impacts. And it impacts not only the physical health in terms of cancers, but also mental health. So I have seen people who live with somebody, they get secondhand smoke and do get cancers. And also it's very hard not to smoke when you're living with somebody. So habits are also one thing which, if I'm living with a smoker, I'm much higher chance that I will myself smoke and jeopardize my health. So I see a lot of that secondhand smoke definitely impacts a person's health, not only physical, but mental and emotional as well. And also kids, if they're growing in such a household, they when they grow up, they're far more likely to smoke compared to kids who grew up in a smoke-free home.
Well, and you mentioned kids, and when we talk about cancer, so often we think about people 50 plus, but can cancer affect young kids too?
So cancer does affect young kids, but the kind of cancers that they get are slightly different. For example, certain kind of leukemias are more common in kids, like ALL, acute lymphoblastic leukemia, or certain kind of kidney tumors like Wilms tumor, certain kind of brain cancers like neuroblastoma, certain kind of lymphomas are more common in kids. Typically, you will not see a child getting, like, say, breast cancer, or a small kid getting prostate cancer or liver cancer. That's more a disease of the older people. But yeah, kids do get, and there are special oncologists, the pediatric oncologists who specialize in diagnosing and treating kids.
Doctor, when we talk about signs and symptoms, someone may have some type of cancer. What are things out there people can look at to say, hey, this is something I need to get checked?
Okay, so number one is your skin. So, every day you take a shower or you're standing in front of the mirror. So if you see a suspicious spot, especially a mole, which I'm pretty sure most people know how to recognize, how to differentiate a mole from, like, say, just skin damage. Um, so number one is to see a mole. If it changes shape, color, or just becomes suspicious, that is something that needs to be checked out because it could be a melanoma. If a person stays in the sun for too long and they have lots of areas of sun damage and something does not quite seem right, then there's a possibility of certain kind of skin cancers known as squamous cell cancer, and those need to be looked at too. Now, if more commonly on the face, if they have certain spots which look like more ulcers or a little bump which doesn't go away, those can be basal cell cancer. So those are just skin, from top to bottom. And if you have a swelling or a mass somewhere, like in your bones, and you notice that you have a bump that feels kind of hard and like a rock, then there is a possibility that it could be a sarcoma, so that those need to be checked out too. If you're feeling more short of breath and you feel that something is not quite right, then you may be having lung cancer, and then those things need to be checked out. If you start losing weight for some reason and you know that you're not trying to lose weight, and some people even lose appetite, so if you lose your appetite, lose weight, then it could be any kind of cancer that's kind of hidden in your belly, so like gastric cancer or colon cancer or pancreatic cancer could present as those. If you have a back pain, new onset back pain, especially like mid back pain, that is not going away, kind of niggling kind of pain that kind of just stays there, then that could be a sign of pancreatic cancer. If you have low back pain, that is just new onset, that could be a sign of a prostate cancer. If you have urinary troubles, like you have difficulty urinating, you see blood in your urine, then it could be a sign of either bladder cancer or prostate cancer. If you feel a lump in your breast, that could be a sign of breast cancer. If you feel lump in your private parts, that could be a sign of testicular cancer. So those are the few signs and symptoms people could watch out for in general.
Doctor, how important is it, and you've done this for a while, how important is it not to ignore a potential sign and get it looked at right away?
It's extremely important because sometimes what happens is that by the time you notice it, it's a great possibility that there's something going on within for, a few months. By the time, you feel something, it may be that stage 1 has become stage 3. So it's important that within a week or two of whenever you notice something, within a week or two, somebody should check it out and not wait it out, 6 weeks or 8 weeks. So for the same reason, people should be up to date on their mammograms. Women should be up to date on their mammograms and on their pap smears. And for men, they should get their yearly prostate exams, colonoscopies, and things like that. So, everyone, all of us go to a primary care check maybe once in a year. But if you see anything suspicious, ideal would be getting it checked out within 1 to 2 or at most 3 weeks.
Because when you talk about cancer getting to that third stage, there are some drastic steps that need to be taken then, aren't there?
Yes. A stage 1 cancer, most stage 1 cancers, we could take care of them just by surgery. But when it gets to, stage 2, advanced stage 2 or stage 3, then most of the times we need to give them chemotherapy to shrink the tumor before the surgeon can take it out. So we are dealing with, possibility of more side effects, more time off from work, and several other health problems that can happen when you take chemotherapy.
Doctor, we've talked an awful lot about cancer and that type of thing. What are the basic treatments for it, and where do you see this headed in maybe in the next 5 to 10 years?
So the basic treatment, as I mentioned, the first, if you're trying for a cure in most of the solid tumors. Now, there are two kinds of cancers. One is liquid tumors, such as leukemias, and solid tumors, such as breast, lung, colon. We cannot do any surgery for leukemias or lymphomas, and those have to be treated by chemotherapy or radiation therapy. For solid tumors, these days we are using surgery we are using radiation, chemotherapy, and in the past, 10 to 15 years, we have seen the advent of targeted therapies, hormonal therapies, as well as immune therapies. So there are lots of options out there, just depending upon the tumor type.
How about moving forward? Where do you see cancer treatments advancing in the next decade or so?
I think we have seen some very exciting advancements in terms of targeted therapies as well as immune therapies. And the basic difference in between the chemotherapy, targeted therapy, or immune therapy is that chemotherapy and targeted therapies go directly to the cancer cells and try to kill the cancer cells by disrupting their life cycle, whereas immune therapy works by releasing the brakes on the immune system and helping the immune system fight cancer. So I think the future is very exciting because we are going to be having therapies which are less toxic. And immune therapies are definitely therapies which are much less toxic compared to chemotherapy or targeted therapies. And in the future, we may use our immune system to fight our cancer as we are doing now. And we have seen some very exciting results when people get immune therapies, and even stage 4 cancer stays away for a while, or in a subset of patients even gets cured.
Now, have you had some success with that type of therapy in your office before?
Yeah, so we have started using immune therapy for past, 2 to 3 years. At Mizzou, we just take on the leading cutting edge treatments very quickly. So I've treated several patients, mainly with kidney cancers, bladder cancers with immune therapy, and we have seen some very exciting results. A couple of my bladder cancer patients who were advanced, stage 4, currently have no evidence of disease. And now I cannot say that the cancer will never come back, but for somebody to have no evidence of cancer going on for about a year, I'm very excited about that. I have one patient with triple negative breast cancer, and it's a very deadly form of breast cancer, and we used a kind of immune therapy on her, which is not yet FDA approved, and for past 1.5 years, she is in remission. This patient was very against using any kind of chemotherapy. She was willing to die rather than take chemotherapy, and so I told her that, if you're completely against chemotherapy, I can try to get the drug for you and see if it will work. And we tried it, and yes, it did work for her. And there is some data on that kind of immune therapy in that kind of cancer, but the noteworthy thing is that it was really not FDA approved, but we do have resources to reach out to the drug companies or for patient assistance program to get some of this kind of treatment for our patients. And I'm glad I did, because currently she's doing very well. And I've used immune therapy now in small cell lung cancer and kidney cancer, and a lot of my patients are doing extremely well. I have had more success in bladder cancers and kidney cancers compared to, like, say, small cell lung cancer, where maybe 1 in 3 patients have responded. And some of the new data in lung cancer suggests that if we add immune therapy to patients who have stage 3 lung cancer, after they've had their chemotherapy and radiation, if we add immune therapy, that is currently extending their lifespan by more than 1 year, more than 1 year before the cancer comes back. And this is just the preliminary data. So, we all have changed our practices. We are using immune therapy as soon as they become approved.
Doctor, I need to ask you, will the day come at some point where we can say we are cancer-free?
Well, I think that will take a few things. It is definitely possible. The first thing that needs to happen is the public to become more aware of their health and, as I said, stop smoking, adopt a healthy lifestyle, aggressive cancer screening programs which detect, gene mutations such as BRCA mutation, and then people just get preventative measures not to get cancer. And even if somebody gets cancer, then new treatments like immune therapies or targeted therapies will definitely help to achieve that goal. Now, these days, there are trials going on where they're combining immune therapy with either radiation or chemotherapy, and definitely the results are far better than either of the agents used alone. So, yes, I mean, I think that, people are living longer and longer because we are able to combine these treatments, chemotherapy, hormone therapy, targeted therapy, immune therapy. So the mortality and morbidity is definitely going down. More work needs to be done, but it needs to happen at all the levels. The general awareness in the public about their own health and the cutting medical advances, the screening of the cancers such as lung cancers to discover them at a much earlier stage, mammograms to detect breast cancers at the early stage. I think the future looks bright with that respect, that one day we can say that, we have a great deal of handle over cancer. One day we will be able to say that cancer doesn't need to be a scary diagnosis anymore. Just like, we have for HIV. Now we have such good drugs that a person who has HIV is pretty much able to lead a normal life. And I feel in the next few decades, we are looking at a picture like that.
All right. Hey, doctor, thanks so much for being with us today. Appreciate your time.
Thank you so much. Thank you so much, Bob.
Dr. Sindhu Singh, she's joined us today on the MRMC Doctor's Office program on KWIX Land this morning. KWIX Land this morning. KWIX Land this morning.